Hi doctors, I'm Dan, this is Kai. We are the directors at Crescent Mortgages, bringing you another FAMQ, frequently asked mortgage question. And as you probably guessed, today's FAMQ is aimed at doctors, specifically doctors who are hoping to achieve a mortgage sometime in the near or distant future. Before we jump into it, we should mention we are aware that there are some areas that maybe are a little bit of a limitation for doctors. You know, your pay isn't always as straightforward as maybe someone in a different profession. So we're going to run through, give you kind of some of the areas that can cause problems, but also maybe reassure you that it is achievable. Before we jump into it, just to remind you that we are CMAP qualified mortgage and protection experts. Yeah. With over 20 years combined experience in the industry. Let's jump into it. Okay, so as we've mentioned, we're going to run through just some of the kind of the common areas that maybe your income may differ slightly from other professions. We're going to start with your contract. So we understand that a lot of you, especially maybe some more kind of on the junior doctor side, a lot of your contracts, you may be on a kind of a 3, 6, 12-month placement. So that position and the hours and the salary isn't guaranteed long term like it would be with a permanent contract in a different field. Now, with a lot of professions, if you don't have a guaranteed income and it is going to potentially change in 6 months or it is just a temporary position, it can cause a problem. But I guess we just want to reassure you to start with that as a doctor, lenders can take a slightly more favourable view. So even if it isn't a guaranteed permanent role and income that you're receiving, generally we should be able to, with most lenders, depending on your finer details, it should be achievable to use your income. Anything to add on to that one?
No, I don't think that's it. Yeah,
a basic one.
More flexibility.
Yeah, exactly.
In short.
Do you want to jump into the next
next
point?
one? Yeah. So pay rises or increments, or just maybe a change of role slightly within your industry. Again, as doctors, a lot of people will be able to see your progression quite far in advance, and you'll be able to see that in 6 months, a year, 2 years, what your salary and your income will look like. Often people want to use that increased salary knowing that you can afford a bigger and shinier property maybe at an earlier stage. With doctors in particular, a lot of lenders will let you use that future income to a degree. So you might be able to use it 3 months in advance or maybe even 6 months in advance. So if you know your salary is going up, you can use the higher income a little bit earlier, maybe 3 months. 3 months we've got a lot, but 6 months potentially with a select few lenders.
Yeah, and that'll
because you're doctors.
Yeah, and that'll be especially applicable, well, to everyone, but maybe more so junior doctors, where you know that once you've gone past this part of your training, there is potentially going to be quite a big jump in your salary, which is going to have quite a big impact on how much you can borrow and how much you can buy for. So if you know that jump is happening in 3, maybe even 6 months with some lenders, then you can potentially start to look at properties now, as long as you can get something in writing to confirm that pay rise is going to take effect. Next point. It's escaped me.
What about partners, GP partners?
That was it actually, yeah. So this is a really common one that we come across. So you may have been employed by the NHS, whether as a GP or salary GP or as a doctor, hospital doctor, and you're now becoming a GP partner at a practice, a kind of an already established practice. For most, if you have kind of over a 15-20% shareholding, maybe even less, a lot of lenders would normally class you as self-employed because you have a shareholding within the business that employs you. In most industries, you would need 2 years in that position as a partner before they are willing to use your income and basically help you obtain a mortgage. But as a doctor, they are more flexible. So often, if you've just got 1 year, that should be okay with a lot of lenders. And actually there are some lenders where even if you don't have your first full year self-employed as a partner, they can potentially still use your income, and they may look at the track record of the partnership and then work out what your income is likely to be based on your shareholding. So again, that is an area where lenders can be far more flexible for doctors than with any other profession. But it does depend on the finer details. Like if it's day one of your new role as a partner, they may need to just want to see a bit more track record. But again, it does depend on the lender. So if you are in that position, contact us and we can obviously kind of run through and work out if it is going to be achievable. We can obviously maybe take your specific details and run the entire case past the lender to you know, get them maybe to run it past an underwriter and work out if they're likely to be able to accept you based on the overall profile of the case. Anything else to add on that one?
No, your new partner, again, flexibility is a bit of a theme. The final point then, so would be the additional income you sometimes receive. So rarely do I see a doctor's payslip that will just have a basic salary. There are normally allowances, bandings, there'll be additional program activities, there might be qualifications, or certain kind of skill sets that you have.
Possibly, I can't remember the name of it. There's possibly for kind of excellence awards for contribution to the industry, exactly. Which they give you basically an additional income, which is pretty much kind of guaranteed moving forwards.
Yeah, and they'll be on, normally those allowances on every pay slip, they're normally the same amount for every pay slip. I'm not talking about maybe overtime or extra hours, which can also be taken, but those ones that are there every time, a lot of lenders in other professions would not necessarily take that income or not take all of it. They might take half of it or portions of it. But again, because your doctors, because those allowances are often written into your contract or backed up with a really good track record, they will normally use most of that income or all of that income, which will then help you get a higher mortgage if you need it, or have more options available to you.
You done
anything? Yeah.
Yeah. No, it is a good point. So I think, as much as I think Kai was talking about kind of those additional activities and that kind of thing, we understand that sometimes there are antisocial hours, night duty, that kind of thing as well, which again, as long as they show consistently, and we understand that they are often written into the hours within your contract, again, often you can use 100% towards affordability, which is going to help you borrow as much as possible. I think they're the main points we wanted to cover. Obviously, everyone's circumstances are different. We'd advise, especially as a doctor, that maybe you do need to seek some advice. Don't just go online. Don't necessarily just approach your own bank, because there's over 100 out there, and your own bank may not necessarily be the best one in terms of looking at your income as a doctor in the most favourable way. So speak to a broker. Obviously, you can give us a call. We can run through everything, take some details, and work out how much you're going to be able to borrow. Like I say, you can call us, you can drop us a message, leave something in the comments, and we'll come back to you. We'll see you next time. Thanks a lot.